Okay. Before I come in, I'm just going to check my physician's orders, and I see that I'll be performing Foley today. I'm gonna come in, knock, 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 provide privacy, perform hand hygiene. Good afternoon. My name is Claire Moran, and I'm going to be your student nurse today. And I'm going to be performing a Foley catheter on you today. Could you go ahead and tell me your name and date of birth, please? She states that her name is Sarah Smith. Her birthday is 12/6/95, and that does match. All right, Miss Sarah, can you tell me if you have any allergies? She has no allergies. I'm just going to confirm you do not have any allergies to iodine, right? She has no allergies to iodine. So we're going to go ahead and get started. And just try to be sure you do not touch any of my sterile field as I am inserting the Foley. Okay. I'm just going to perform hand hygiene, and I'm going to put on clean gloves, and I'm going to check for peri-care. See if there's any peri-care needed. I'm just inspecting, and there is no need for any peri-care. So let's go ahead and get her in the dorsal combat position and get her ready to get this Foley inserted. Now, I do have the curtains drawn, so you do have privacy, but you are going to be exposed down here just a little bit as I'm inserting it. So just give me just a few minutes. So I'm going to take these gloves off. I'm going to perform hand hygiene, and I'm going to go ahead and pull this out because I'm going to need this for documentation. And then okay. Now I'm going to get my sterile gloves out. I'm going to place my right here, and I'm going to just perform hand hygiene again. So I do not need this, so I'm going to dispose of it. I'm just going to set this on the side just in case I need it. I'm going to go ahead and get my tray out. So she is not allergic to iodine, so we're going to use this. So I'm going to go ahead and open it. I'm going to pour it over my cotton balls. We do not need the hydrogen peroxide. I'm going to put the petroleum jelly right here. Dispose. Okay, now what I'm going to do is I'm going to go ahead and connect my syringe to my catheter. Just getting everything ready. Okay, and I'm just going to let that lie right there. And I'm going to get my catheter ready to insert it into the jelly. Okay, I'm going to dispose of this in the trash can, and I'm going to just place it right here in the jelly. Okay, now I'm just going to go ahead and clean her with the iodine, so I'm going to place this in here. Now it is dirty, so I'm going to get my cotton swab, and I'm going to go from the outside down. Then we'll come to the other side and go down. I'm gonna go to the middle and go down. Okay, so now I'm done with that. Now I'm gonna go ahead and I'm gonna ask her to take a deep breath, and we are going to insert the catheter. We're gonna go 2 to 3 inches, and then once I see urine, I'm gonna go another inch. Okay, and she's there. So now I'm gonna take my hand off, and I'm gonna place it back here, and I'm going to insert 5 cc's. Okay. Now I'm just gonna give it a little snug pull to be sure it's in there, and it is. So now I'm going to dispose of these gloves. Okay, I'm gonna perform hand hygiene, and I would put on more gloves, so I am verbalizing that. And I'm going to take this off. I'm going to throw it away. Now I'm going to get this, and I'm going to want to connect this to the immovable part of the bed. But first, I want to tape this on, and I would write on here my name, W. Moran, SPN, ECCC, and the date and the time. The date is 10/20/21, and the time is 10:30. Insert that, tape that there, and I'll give it a little room so she can move around. So I'm gonna go ahead and place this over here, and it is on the immovable part of the bed down here. Okay, now I'm just going to start disposing of all of this. And I can throw all this away because this has not been contaminated. So I'm just going to throw all this in the trash can. Okay, I'm going to I'm going to take my gloves off, perform hand hygiene. Now I would put on more gloves just to get all this. Okay, I'm going to dispose of this properly in the biohazard bin. I'll let her legs down. And I would ask that you do not pull on it, because if you pull on it, it could cause some pain. So we ask that you do not pull on it. I'm just going to be sure she's comfortable. Is it comfortable? And it is. So I'm going to go ahead and I'm going to cover her back up. You're not in any pain, right? She said she's not in any pain. I'm going to go ahead and lower her. And if you need me, call me for any reason. If you experience any burning, swelling, anything like that, just give me a call if you think something's going on, and I'll be right down. So the side rails are up ×2. The bed is in the lowest position. And she states she has no pain. So I'm going to take my gloves off, perform hand hygiene, and go document appropriately.